wait, let me find out if really this is the real deal. So it says hotline for healthcare workers, and then that got my attention, obviously, especially during these times of COVID-19. And YNITU has been complaining so much that there is really not much support that the healthcare workers are getting. And yeah, so I got a number here. It says 0800 11 1131, and I thought, oh, it looks familiar, like the COVID-19 hotline. But the message was saying, please utilize this number as healthcare workers to support, to advise, to report, to ask. You will be treated with the highest level of professionalism. And I thought, okay, this is very interesting. And I think if there is that type of helpline, and where I, as a healthcare provider, as a healthcare worker, can call, why not? And I thought it would be interesting to call with you, and let's see what happens, and let's see what type of information would be able to solicit and be able to get from.
Thank you for calling the National Health Laboratory Service Coronavirus Disease 2019 toll-free hotline.
Okay, it's a coronavirus toll-free hotline.
For more information on coronavirus disease 2019 in South Africa, please visit www.nrcd.ac.za. Please hold for the next available operator. Welcome to NICT Coronavirus Hotline. How may I assist you?
Hi, ma'am. How are you?
I'm fine.
I'm great. I didn't get your name. Lerato Mukoni.
Yes.
Lerato Mukoni, o bua le Lerato Madumo. I wanted to, in fact, ke bone message ko one of the group Zamanes to say this number is there to support healthcare providers, to give them information and also offer support. Is this right?
Yes.
Okay, perfect. I wanted to find out if I have a patient with all the positive symptoms of COVID-19 and they present at my clinic, where do I send them for testing?
The hospital.
To the hospital. Okay, so I'm in Gauteng, a hospital. Which hospital will that be? Is it any hospital?
Yes. If you've got tools for collection, you can still collect the swab and send it to the laboratory.
Okay, we don't have, all the clinics currently don't have any tools of collecting specimen. So I'm asking specifically, would that be for all the hospitals, or is there a specific hospital that I can send my patients in Gauteng?
We have specific hospitals,
Mm-hmm.
like you can do Charlotte Matrix, those hospitals that were listed for admitting the COVID-19 patients. Because most of the hospitals are still not comfortable with suspected cases patients.
Not all hospitals are comfortable with testing.
Not all. You see the hospitals that were listed.
Yes, there's 10 that was listed, yes. For Gauteng, there was 2.
Yes.
Mm-hmm.
Then you can send them to Charlotte Matrix. But before the middle of this month, they will have testing stations that already started. Now we've got a gift of the givers in Joburg now.
I'm listening.
Yeah, Gift of the Givers is also a testing center in Joburg.
Where is Gift of the Givers in Joburg?
It's fantastic. You can just Google Gift of the Givers, so it will give you the direction.
Okay.
And then we've got the other one, testing station in Alexandra, but they are still busy finishing with all the set up, and they are still organizing the process of also making testing station at our local clinic.
Okay, let's talk about Joburg Gen. When I ask my patient to go to Joburg Gen, where in Joburg Gen do I go? Because Joburg Gen has got 5 blocks, and in each block I've got like 9 stories, like 9 floors in each block. So where do I ask them to go so they don't go all over the hospital?
No, they go to ER.
They go to casualty.
Yes.
And casualty
Because remember that when in casualty they are wearing N95 because they are coming in contact with different patients, so they are the only ones that are in position to test the patient, because even when the patient comes, they are already protected because all the ER staff members now, they are wearing the N95. They are obligated to wear the N95.
So some of my patients that have been sent to the centers are saying we were not able to get help. Where can they report? Does this line help when I've sent them to CMJ?
We had the doctors also calling us to say it's because everyone is so scared of the disease. Like it's a deadly virus, so we understand. Then everyone is just scared that might contact this disease and maybe take it home to the child. So that's a problem they are having everywhere. So they are taking out those concerns of Department of Health at the moment. Because the doctor will do refer such cases where the patient went to the hospital for the suspected case. Finds symptoms, but it says I'm at a hospital, and they actually refusing to help the patient. So we transfer those patients to the clinician and then they take it up with the Department of Health.
Okay. Now, if I'm a nurse and I believe that I've been in contact with a suspect or a confirmed case, where do I go for testing?
Okay, the protocol that it's followed at the moment, because they are busy with a certain number of the patients, is that you need to be at home for self-isolation for a period of 14 days.
So you are saying if I'm a nurse or I'm a doctor and I believe I've been in contact with the patient, I must stay home. Is there no other thing that I need to do before I decide to go home?
You can, at the moment, the criteria that is the self-monitoring tool, like it must be a confirmed case that you have been in contact with.
I'm saying it's a confirmed case. I've come in contact with a confirmed case. So where?
Yeah, then you fill the PUI form, the person under investigation, and then it got the form. When you download the form underneath, you will get the self-monitoring tool form. So that tool is just take it for monitoring your temperature on a daily basis. So
there's no immediate testing for healthcare providers.
No. There's no immediate testing yet. If you can follow the PUI from the person under investigation, it will tell you that the person has with a temperature of 38 degrees Celsius, not having a dry cough, difficult in breathing, so there's no immediate testing.
No, I'm looking at the PUI form from NICD. It gives me a healthcare. It says all healthcare provider that has been in contact. On the next block, it says to me the healthcare provider must be not just isolated, must be tested. That's what I'm reading from the protocol. Am I reading it correctly?
Okay. It says you must be tested if you were in contact with a confirmed case and having a case down the symptoms.
Yes. So I'm saying.
So when we are expressing the symptoms, they don't immediately test. As long as you're in contact with somebody, they are not testing everyone who has been in contact with a confirmed case. So if you are presenting with any of the symptoms,
okay.
that's what they consider.
Okay. I think maybe I'm misunderstanding this document. It's saying to me, the person under investigation, the PUI, meaning that if I'm presenting with acute respiratory illness or maybe any cough, sore throat, shortness of breath, my temperature is high, and I have symptoms of onset, and then it gives me all those symptoms, and then it says, had a history of travel, or I have worked I've attended a healthcare facility where patients who have been infected. So if I work, it doesn't say I must have symptoms. Symptoms is a criteria on its own. And then me working.
Let you hear this from the clinician. I think you'll be more comfortable. Can you
Please,
hold?
I'd like to hold for the clinician.
Please hold the line while you are put through to the next available clinician.
I'm good. I'm working. Yeah. I'm on a call. I'll be with you just now. Hi, doctor. I didn't get your name. I didn't get that still. Okay. Okay, that's fine, doctor. You're speaking to Lerato. I was talking to the agent that answered the call. I'm struggling with just interpretation of this NICD person under investigation. I see one of the criteria is they accept the symptoms and accept the travel history. And the third one, this is the one I'm interested in because I'm calling because I want to understand it for the nurses specifically. It says if I've worked in or I've attended a healthcare facility where patients have been have been infected, and then it takes me to the infection control block, where it says early detection is key, and then it maintains that healthcare workers should maintain a high level of clinical suspicion. So my question was, if I'm a nurse and I work in a facility and I know I've been in contact with a positive case,
Okay.
where do I go and test?
So, the testing criteria is number one, you have to show the signs and symptoms. A sore throat, a cough, a fever. And then, together with that, if you have been in contact, then you do qualify for testing.
Okay, meaning that this guidelines are wrong, because it says all. It says all the symptoms that you are referring to, and secondly, it says if you have a travel history, it doesn't say anything about symptoms. And then thirdly, if I've worked in a place and with a person that has been tested positive or I've been in contact with the condition. But what you're saying, doctor, you're saying I must first wait for the symptoms to present with the symptoms before I get tested.
Yes. So the first bit to the criteria is you must show symptoms.
But it doesn't say symptoms end. It says all. And that's why I'm saying my biggest interest is on being a healthcare provider. I know I've worked or I've treated a person with corona. What do I do? I go home and wait for 14 days? Do I report this, and do I get myself tested? Because my worry is that in the later stage, because I'm reading this with the Compensation Act, in the later stage, because I did not report and I didn't get tested, I cannot come back and want to cry foul when something adverse has happened to me. Do you get where I'm coming with this? Because the guidelines to me are very clear. They're saying all. They're not saying I must wait for symptoms. Are you still there, doctor?
The first bit, yeah, I am.
Okay.
But the first bit is show symptoms. And then if you show symptoms, then you're high suspicion. And then to get back say, and together with that, you can have.
Are you able to send me the one that you're reading? Because the one that I'm reading, it's got or, and it's giving me four instances where you definitely have got to be early detected even before showing symptoms. And I'm just honestly worried that majority of our nurses have not been tested. I don't know if you're following. The doctors are testing positive because they are going and testing themselves privately. But the nurses are told to go and stay at home and wait for the symptoms. In the meantime, they are going home to their families and they are still in contact with the community. And for me, that can't be making sense.
Because at the moment, our labs have a very big backlog. So we're not testing anyone who does not show symptoms.
Okay. Is there anywhere private where nurses can go if they believe they don't want to wait for the symptoms? They know for a fact that I've treated a coronavirus patient and they want just to clear themselves, just to allay their anxieties. Do you have any alternate, even if they have to pay for themselves?
Because at the moment, all the private labs should be offering testing.
Okay.
I'm actually not entirely sure, but from what I've heard previously, they do offer
Okay.
for a price, yeah.
All right. No, thank you so much, doctor.